Mindy, hi, and thank you so much for joining me on Faces of Digital Health to discuss the innovation in the NHS and the NHS Innovation Accelerator. But just before we begin, I'd really love to ask you about how you are doing. It's September when we are recording this, and recently I just want to share something on the screen. This graph has been quite popular on LinkedIn, prepared by Liam Cahill, about when to sell to the NHS and how the NHS works like. And if we look at the schedule, it's September, it's prime contract time. So companies should start putting out more tangible proposals and communicating plans and intentions. So how's your September going so far? How's your autumn looking up, and what are you doing in the accelerator? Where is your focus at the moment?
I think that graph is quite honest about it, particularly that August bit, where you've got your lull, where I don't think anybody works in the health service, and also like the NIA, it's our sort of, I'd say quiet period, but we don't really have a quiet period. September for us tends to be all systems go, and it's because when we start to do our recruitment starts on the 1st of September for our next intake for next year. So while we are alongside helping our fellows to navigate the NHS and work with the NHS, we have the kind of separate piece of actually trying to recruit a whole new batch of fellows. And that involves quite a lot, of course, preparation for paperwork, etc. But then there's also a lot of talking. So we do quite a few webinars where we speak to innovators about, what's expected, what can we give them, what we expect from them, and what the kind of application process looks like, because it's quite a detailed application process. So we want to make sure that people have as much support as they can while they're doing it. And then we also do, there are some conferences that we attend just to make sure that we are speaking to people on the ground, getting out there, and also speaking to NHS. So September is a kind of weird place for us. It is definitely helping innovators connect with the right people, who might be looking for contracts or who might have money available. But it's also for our program itself, super busy. I want to say something about that graph, though. I don't think September is the only really busy time for funding. I think if you're looking for funding, you need to start also in February. And March, at the end of people's budgets, is when they start to realize whether or not they've got extra money. So that is a super busy time also.
Okay, yeah. Usually the beginning of the year is also when companies start planning, so their marketing budgets and things like that. So if you're working in that area, that's definitely a good time to reach out. And you mentioned basically that you are getting in touch with entrepreneurs, trying to, raise the awareness about your program. And this is also why we are here today. I actually wasn't aware of the program myself, and I think it's great, that a public system such as the NHS has such a program. But I do want to clarify, how do you fit in the NHS? Because since 2016, the NHS has also had the National Clinical Lead for Innovation, which established the NHS Clinical Entrepreneur program. So how do you, as the NHS Innovation Accelerator, differ from that program? Is there a difference in who should go where?
Yes, definitely. There is a difference. And there is some overlap, which you will find with any sort of program of support. So the Accelerated Access Collaborative funds the NIA, the Clinical Entrepreneurs Program, which we call SEP, because I'm going to say that at some point, and the SBRI. So they fund 3 different innovation-focused programs. And there's a kind of a clear difference between the 3 of us. So SEP tends to be for more early stage, when you've got ideas. They will nurture those ideas, help you think, is this a good idea? Is this something we should be doing? It's really about helping you network and build sort of a knowledge base, so ideation becomes a reality. Or it might just be that you've got a really good, you want to be in innovation, but you don't necessarily want to be an innovator. So there's a difference between, there might be people who want to support innovation, but not necessarily want to come up with their own innovation, and SEP is fantastic for that. Whereas because we're a much smaller program, we take up to 24 every year. That support's a little bit clearer. It's a little bit more about you as an innovator and your innovation. And then SBRI is all about the funding. So they don't necessarily take only SEP or NIA fellows. They take anybody who's got a really great innovation within whatever theme they're looking at to support that year.
The NHS is investing in innovation through various funding mechanisms. We were looking at the annual schedule. So how does the NHS Accelerator fit in the story? So how do you see that you can help startups?
So the situation with funding is we don't provide money ourselves, and we don't have any access to funding directly. And that's because everything needs to be a fair and open process. So you should never really have one place that you go to that always pushes things forward. It should be open to any innovations available. So completely support that. But what we do is we do feed into those discussions around what the kind of challenges that need to be addressed within the NHS are. So where should that funding be kind of funneled through? It's a big piece to kind of help determine what funding goes where. And often our advice is around, how do you alleviate those barriers to innovation? So it's great that if you have funding, I mean, that's fantastic. But if you've got funding that can't be channeled properly and that can't go to the right innovations, addressing the right problems, then there's an issue. So what we do is we kind of sit in a space where we're able to support the NHS to understand better what's out there, what's available, what does a good innovation look like. It's sort of an education piece about insights. And how do we support those innovators is we do certain things. We do what's called guiding them. So we help them to understand what they need to do in order to work with the NHS. So that's through, first of all, our learning program, which has sort of two parts to it. And as I said, innovators are with us for 3 years. So the two parts are, in the first year, it's all about giving you the tools. And I always use an analogy of learning to fish. It sounds, because what we're here to do is not give them the fish. It's not put them, say, this is your contract. What we're here to do is to allow them to accumulate that knowledge so that they can go out and do that fishing themselves. So we put them in front of those key decision makers. But when you're in front of that key decision maker, what you need to be able to do is talk that language. So that's what we're teaching them to do. What is the language that's going to resonate with that stakeholder? Will they be looking more at your value proposition? Will they be looking more at your evidence base? Will they be thinking, how are you addressing health inequalities? It's very much them understanding the kind of landscape that they're working in and having the tools to work with that landscape. The kind of second part of the learning is also about just updating them on what's happening so that you understand what you're playing field that you're playing in. If you don't understand that there's funding that might be coming from a certain area or there's a focus in a certain area, then how are you going to work with them? So things like because of the political situation in the last few months, with, of course, at the time when the general election was called, nobody had really any idea about what the parties were going to be focusing on. We help the fellows to understand that Labour is looking at this, Conservatives looking at that. So down the line, you need to be thinking, if Labour wins, this is what you need to be considering. If Conservatives win, this is what you need to be considering. Now, once somebody's elected, that whole thing sort of changes, that landscape. So again, it's about helping them to understand that the current government, this is their focus. So very much the second part of that learning is about not giving them necessarily tools to go out, but giving them the information that they have in the back of their heads so that they know as they're working what they need to be considering. We also give them set packages of work, which I think makes us sort of stands us out from other sort of innovation programs. There's certain areas the health service are asking for. And they want to make sure that innovators are engaging with it because there's societal problems and things that are very much being pushed out. So let's think of like net zero. The NHS has an aim to become net zero in, I can't remember, they keep switching the goalposts. I think it's 2045, around that area, where all innovations have to be at a certain level and making sure that they're not contributing to carbon emissions. We are making sure that our innovators fully understand what, where do their innovations sit in that pathway? What are they doing right? What are they doing wrong? We do really deep dives into each innovation. So this is not just a sort of generic things like the guide about the learning. It's very much about that specific innovation, so that we create a plan for them of what they need to do next. And we are going to start doing it roughly for procurement, not necessarily giving them a development plan for procurement, but having given them an idea of exactly how their specific innovation can be procured within the NHS.
Can you explain a little bit further or give an example or two on how does the net zero policy impact the way that startups think or design their solutions? For applications, it might be difficult to imagine how they can impact the net zero policy.
So at the moment, and I think this is one, I think you've kind of hit the nail on the head there. It's really difficult for innovators to understand what they need to be doing. There's a lot of information out there, but sometimes because there's a lot of information, it gets even more difficult to understand it. I think right now, and again, it's all about, if you're a startup now starting up, you'll have a lot more influence on what you can do. If you're a startup that's further down the line, you need to be considering what your carbon emissions are. There's I can't remember what it's called. I think it's a carbon emissions impact assessment you need to be looking at. There's what can you do to change, not necessarily right away, but over time that will help with that target, i.e. like if you're something that will involve an innovation that will involve a lot of equipment, how is your equipment disposed of? How is your equipment used? What is the life cycle? There's no one set kind of way that innovations can look at it, because it depends on the innovation and what they're addressing. If you're digital, how much space are you going to use within the cloud? What is the and that's it. It's like, it's so specific about that innovation, because again, you might be using a very small bit of space, somebody else might be using a lot. It really just depends on that innovation. There is a lot of, as I said, material out there on this to try and decipher. But that's what we aim to do, is to help our innovators decipher that, to really understand how they can help with it. But it's difficult. It's really difficult, I would say. But if I was an innovator now, I'd be reading up on the Green NHS website and just trying to think to myself, I am here now. This is how much I use. This is the material I use. What can I do to do better? And there's going to be a cost to that. So where's the funding going to come to do better? Because at some point, we can only hope that the NHS will provide some funding for innovators to move to a more green space. But, that I imagine that's probably the hardest part, is just not having any spare cash to move towards this.
I don't know if you already answered the next question, which is what's the biggest challenge that startups face? If we look at the debates around innovation and NHS, I would say that the general sentiment is that it's really difficult to sell to the NHS. So where do you see the biggest challenges for startups? And then I would also really be interested in hearing, what do you think is the easiest thing for them, if there is even such a thing?
I think most people think the hardest thing is funding, is about making sure you've got a cash flow and you've got cash. For me, the hardest thing is visibility. That's your biggest issue, is people knowing that you're there and knowing that you are worth taking on. So it's getting that first contract or that first pilot site to prove your worth. And for me, that is, again, as I said before, it's really crowded. And it's not just being seen, but it's who are you going to be seen by? You can be seen by someone who really loves you, but they're not a decision maker. You can be seen someone, a patient. I say they're not a decision maker, but every single person who interacts with your innovation can be your advocate. They will shout loudest. Your patients, if they will push, there's a lot of, if you look at the kind of American model, I guess, and you kind of compare us to that, which is very different. patients in America have a lot of power. They get to decide, and they are the ones who push their healthcare professionals towards certain pathways, towards certain medicines. I don't want us to move to that state, but I do want us to ensure that the patient voice is being heard, because they will be your biggest advocates. So innovators have to have that visibility, not just from the decision makers, i.e. the people who will pay them, but the clinicians who will use them and the patients who will use them.
And is there a company or a startup that you could mention as a case study or as a good example where that visibility was successful, and how basically did the company come to the end result? So what steps have worked for, a specific company that you might have in mind, if there's any examples that you want to mention? And I definitely love to then also continue with what did the startups actually do, the ones that you take under your umbrella. So yeah, is there a case study that we can go through?
This was almost like choosing my favorite child, I think, when I looked at this question. And that's difficult, because I think what success looks like is very different depending on the innovation. I'm sorry, this is a kind of sideways bit, and I'll talk about an innovation that I think is quite a good example afterwards. But I think success changes by innovation. I think if you're looking for, it depends again, what is the innovation's main purpose? Purpose, I don't think is the right word. What does the innovation hope to achieve? So if the innovator is looking at this as a career that will make them money and will be their main source of income, it's very different than an innovator who is looking to have a big impact on the lives of patients and to have it rolled out. So if you look at things like joint dementia research, they are all about, it's not a name you would necessarily know, it's not like one of those ones that's all out there. But what they have done is allowed patients to get involved in clinical trials, which is a huge thing. It may not be something that's the forefront of people's minds, because clinical trials, that's not healthcare. It is absolutely healthcare. But they have done that, and they're not looking to make a profit. They are looking to do something good. So that for me is a different measure of success than any sort of commercial company. It's are you a non-commercial model or a commercial model? So I'll look at if you're looking at something that needs to be like kind of leading player in their field, is super well known, I would say Orca. They are they're right out there, and even I said their name, and you know who they are. Everybody they're synonymous with that kind of healthcare apps and making sure things are reviewed properly and that they're the right level. Everybody knows about them, and that's because they have been excellent at getting out there and speaking to key decision makers. They knew their market. They fully understood what it was they were doing. They didn't go in there and try and blag it. They developed their knowledge and their understanding of the industry that they're playing in before they decided to push themselves out. And I think that's probably the first thing I would say to innovators is don't try and blag it. Don't send somebody out there who cannot speak the language, because you will be quickly found out. And distrust is something you do not want in the health service. You want people to trust and have confidence that you know what you're talking about. And then they will grow that trust and confidence. And that's what Orca has done. They've gone out there and built the confidence in their knowledge. So I would say they're probably one of our biggest successes in that way.
We started this discussion around, innovation and applications, and the fact that you are now looking for new applications and companies to join the accelerator. All the information is on the website where people can submit their application, to see the reasons why they should apply. Very briefly, who would you say should apply? When's the deadline? And what are the key 3 things that people considering applying should know?
Okay, so the deadline is the 14th of October, and I'm glad I remembered that. Who do I want to see apply? I want to see anybody with a really great innovation. That's the God's honest truth. I think there's some areas that are, completely underrepresented, some sort of condition. So like oral health, nobody kind of works within that space, but it is huge. And I don't understand why there aren't more innovations there. Women's health, because I'm a woman, and just generally because we're 50% of the population, I want to see innovations that address that. Will we turn away any innovations that don't? No, absolutely not. I think anything that's really, really great. One of the things that I want to say to people is, please do not think that you need to be a specific type of person. This is not about what you look like. It's not about your job from before. It's not about your background. It's about you as a person. I know it can be really scary to apply because you're thinking to yourself, everybody else is going to be better than me. They're probably not. They're just human. And that's the thing you'll learn when you're on the accelerator, is that you're all in the same sort of boat. When you're an innovator, it almost neutralizes those kind of aspects. You become all, on the same level and the same level playing field. So don't be afraid to apply because you think somebody else is going to be better than you or has more than you. The second bit is care about what you're applying for. Please don't just apply if you're not going to turn up for any of these sessions or you're not going to engage. This shouldn't be a badge. This should be using the plethora of resources we will provide to you. Engage with us. Come and jump on this journey. We are super excited to see any great innovations. As I said, oral health and women's health are probably my biggest ones, but I have a co-director. He's got other things that he cares about. I have other team members. We all are just passionate about seeing great innovation. But that point of please just apply. And if you need support, we'll help. I'm always happy to help and have a conversation with people. It is scary. It's really scary applying for something, but you never know until you apply.
Exactly. Mindy, thank you so much for sharing all the insights and all the details about the program. And I look forward to seeing what you've chosen for the next cohort. So the deadline is 14th of October. When will you announce who got in and who didn't?
So far away, not till next year, April. On the 27th of March, we have a launch party.
Okay.
But that's because the recruitment has to be super rigorous. You go through two different stages where you are assessed on paper and then you're assessed in person through an interview. And in between that, you're looked at through health inequalities, PPIE, and net zero lens, as well as NICE. So there's a lot of hoops to jump through. And the reason why people trust us is because people have a lot of hoops to jump through. So it's really important to make sure that, everybody's doing what they need to do.
Awesome. Well, Mindy, thanks again and good luck with the selection process.
Great. Thank you so much.